Right now, we have a feed from the Information Ministry. Dr. Medusa Akodie, who is the Director of Public Health with the Ghana Health Service, is at the Information Ministry at the bi-weekly news conference. Let's go there live now. So we have a freeze in that feed there. Once we correct that, we'll go back to the Information Ministry for the last in the bi-weekly series on COVID-19, where we have some updates from the Ghana Health Service and the relevant agencies. Let's go back to the Information Ministry.
As the time of mentioned 16th June stands at 6. Total number of cases that are active stand at 8,395. And these are people that will be managed on treatment sites in isolation centers, and some of them under home management. 14 cases are classified as severe, and 4 are considered or classified as critical that are on ventilators. The slides will give us the distribution of the cases per region. These are the regional distribution. Total number of 339 new cases reported from 36 districts in 8 regions. The regions that reported cases are what you see here. Greater Accra reported 154 cases from 17 districts. Western region, 58 cases from 2 districts. Ashanti region, 41 cases in 5 districts. Central region, 38 cases in 1 district. Eastern, 38 cases in 1 district. Eastern region, 15 cases in 2 districts. Volta, 3 cases in 4 districts. Bono East, 9 cases in 3 districts. Northern region, 9 cases from 1 district. And Savannah, cases from 1 district. The next 2 slides would give us the various differences that we had from the previous updates till now. And Greater Accra reported total of 154 cases, new ones. And those districts, 17 districts that reported cases are what you see on the extreme right column. Eastern region, 15 new cases from Upper Menya, Krobo, and New Jabin. Central region, 38 cases, all from Cape Coast. Western region, 58 cases from Wassa, Menfi, Takwa, and Suayim. Upper West region, okay. Volta region, 13 cases from Ho, Agotime, the K2 North and Pandu. Shantu region, 41 cases from Asqua municipality, which is now the hotspot for the region. Obuasi 7 cases, Kumasi Metro 1, Ejoso 1, and Mampo 1. Saboba, Northern region reported new cases from Saboba, and Savannah reported 2 cases from Central Gonja. Bono East, 9 cases from Pro East, Techiman, and Upper West region, Upper East, Northeast, West North, and Bono East. Bono the region and Ahafo region did not report any new cases. Your Honor, the Minister of Information, distinguished ladies and gentlemen, the situational update on the case count on COVID-19 for the country, Ghana. Thank you very much.
Thank you, Dr. Medusa Akodie, Director of Public Health at the Ghana Health Service. I want to invite the Director of the Ghana Health Service to explain to us this amended discharge policy is. There's been a lot of work, you inform us, that has been going on looking at the data of how the virus manifests in people and the kind of risk levels associated with that. And based on that, you have decided to amend the discharge policy. If you can give us first a background and explain to us what this amendment means.
Thank you very much, Honorable Minister. Good morning, ladies and gentlemen. I will just be, as the Minister for Information said, I will take you through the policy decision, the rationale and the evidence behind the policy. As you saw from Dr. Bedisa Akode's case, you can have a significant number of full active cases. As whether they are really active. Active cases also mean that these are the people we need to worry about, we need to take care of. And so we need to really properly define them. We also know about recent concerns, though not wholly true, about the congestions in our hospitals and isolation centers. These have all created part of it. Ghana's discharge policy was started from March when we started having our case, and those were based on the WHO guidelines, which was published, an interim guideline published in March 2020. In those guidelines, it was more of a test-based strategy, and the patient was discharged after getting 2 negative PCR tests within 24 hours apart. Initially, because the numbers were few, this was adequate policy. But with an increased number of cases, now we are talking about 12,000 plus, it brought to fore some challenges, and not just Ghana, globally everybody started having a challenge. First was the rising cost of tests. I've already told you that the test is not as simple as we make it look, it's quite expensive. We also talked about the fact that because of that policy, each person who has had 10 positive had to do 3 tests to be discharged. That's your first positive test, your first negative, and your second negative. If you are lucky, you don't have repeated positives along the way. So you have a minimum of 3 tests. And if every test costs you so much, you see what it takes you to. The increasing workload because people were staying in hospital just waiting for their results to be able to be discharged. That also had implications for sustainability, feeding, etc. And most important, the social cost to the patient who is not ill but is being kept to, as it were, stay awaiting a result. And so that was the last one. But new data started coming up. The new evidence is that the viral shedding and clinical presentation led to many changes in our policy, not just in Ghana, Singapore, the European countries, and WHO, among others. So on the 27th of May, a new release from the clinical management guidelines modified the discharge criteria. Let me also just pause here and explain the difference between discharge and recovery. They are not the same. Discharge means, as I will go through, means that you are healthy, you don't pose a risk to anybody, and so you are discharged. But we'll go ahead and see that I've tested negative, and then create that you are viral. But I'll give you the symptoms. So the new criteria combine time-based, symptom-based strategies. That's the duration when you were contracted up to the time, and also what are the symptoms? Are you still coughing, fever, etc.? These are the 2 combinations that that is more that helps us. For cases discharged after a period of time and symptom-free, that is for those who are not showing any symptoms. Period of time is the initial, after the initial test was done. So basically, we have the time-based, that is those who are not showing the symptoms, is about how long was he tested positive and how is it now. And for those who have symptoms, are they still exhibiting symptoms after a certain duration of time? I will determine whether I will discharge them. So based on that, WHO and our guidelines made 2 recommendations. For symptomatic patients, that is those who have exhibiting cough, fever, who are sick, for say, 10 days after the symptoms of onset, plus at least 3 days without symptoms. So 10 days from the positive test was done, up to the time that you have 3 days, a minimum of 3 days. So if you, after 10 days, you do have to show that no symptom for the next 3 days, you are discharged without a test. For those who do not have symptoms, the WHO recommend that for 10 days after initial positive test, you should be discharged. There new evidence that we can show. Evidence of many studies have shown that they continue to shed virus from the upper respiratory tract, that is from the throat, nose, etc., approximately 7 to 12 days. And in respect of the number of the viral load, after a certain period, they do not share. In Ghana, our own case management team have followed about 146 patients, and all of them had tested. The average time for testing 2 negative was 14 days. So in view of all the evidence that is coming out across the globe, we decided, with all the context that I have done, to review our policy to reflect the new trends and also decongest the place and also allow us to focus more on the sick. So we, as a service, met all our directors and our stakeholders, other scientists were consulted, and these were the new protocols that we had agreed to. That for patients who are asymptomatic, that's, for example, somebody in PCC, etc., if you are admitted to the Pentecost Convention Center or any of our isolation centers, 14 days after the initial positive. The initial positive is not when you receive your results. It's the day your sample was taken. Because that is when you're positive, not when the results came. 14 days after that, we will discharge you without a test. For those who are symptomatic, we do 14 days after discharge, and then if you are without, after the testing positive, if you are without symptoms, you are discharged. Home after 3 days of no symptoms, you are discharged without a test. What we'll do is that then you'll be asked, because you don't pose any threat, you'll be now doing a negative test on the at home, and come for review, and we'll see that. So that's when that will do. So we have reviewed that. We realize that quite a significant number of people who still remain on our books because their lab results are not in, they would all be discharged unless they have conditions. So basically, this is a new policy. The policy is that 14 days for asymptomatic cases. For time that you are tested, you took your sample, you'll be discharged. So if I was sent to, they took my sample on the 1st, I took all my results on the 3rd of March. I moved to PCC. On the day I arrive, I know that on the 14th of June, I'll be going home. And you have some predictability as to when you go. For those in hospital, and usually within 10 days, symptoms abate, then we'll do 3 more days. If you remain stable, then you are charged. And we hope that will also help us allow us more time to focus on the new cases, to give more attention to those who are newly positive, and then also create space in our facilities to be able to take care of more cases, which we really do not hope that we get. Thank you very much, Mr. Minister.
Dr. Baji, thank you. So if I understand you, we haven't amended the recovery definition. What you have done is to amend the discharge policy in line with WHO guidance and then the local evidence. Correct? Yes. Okay. All right. Colleagues, we'll take your questions at this point in time. We'll get as quickly as possible because we've already spent some time. So if you have questions, could you? I have 3 here. Do I have any other takers? Yes, sir. So do I have any other takers? 5. And should I wrap up after these? Oh, so I'll wrap up after these 5. Yes, so I'll start with you. Let's space out, please. Yes.
Thank you very much. My name is Sarah Paku, Media General. Please, first, I would like to find out this discharge policy that is being amended. When the person goes home, we understand that after you have been treated, there's a likelihood that you can test positive again, if I'm right. If he goes home to stay with family and friends, what is the plan like? Is he going to isolate some number of days, or he can live a normal life whilst living with the family? And I also want to find out if this is to decongest the facilities. Was it really true that these isolation centers and treatment centers are congested or are full? So people, even in the Greater Accra region, being transported to places outside the region. Please, thank you.
Thank you.
My name is Fred Lanyomegashe with GH1 Television. I have a quick one on evacuation Ghanaians. Not just in light of the concerns of killer evacuation charges required of the UK evacuees, I'd like to know if government has a subsidy for Ghanaians who are willing to come home but do not have the means to do that.
Government subsidy for evacuees. I'll take that. Let's go.
My name is Kujajman. I work with CTV. I just want to find out that when the COVID cases started trooping, we listed a number of hospitals can do Ghana's case management. We want to know, has the number increased? Yes, you can mention them for us. Has the number increased? Because right now we're getting a report from the Ashanti region that some centers are full up, therefore they are calling on private medical health facilities to come and join. And we also want to know that do we still maintain that people who want to come to Ghana voluntarily should pay for their upkeep? Because yesterday, I read from a member of the minority that government came to Parliament for some funds to cater for these people. So it's amazed as to why government is asking persons like to pay for their upkeep. Thank you.
Honorable, good morning.
Hold on. If I just may understand your question correctly, government went for funds for the management of isolation and treatment centers,
Or
government went for funds for the upkeep of evacuees. They are two different things. So what was he referring to? Just
government went for money for upkeep of persons who will be quarantined and isolated, which includes people who come from outside.
They are saying that includes.
Yeah, that's
okay. Sure. So for the upkeep of evacuees, I think that's where the question. Okay, Kojo. Yes, sir.
Honorable, good morning.
Morning.
Friend me JC from Cry FM. Pacho, my question is say mba pemfo omo won kwala omo ye nurses no omo kwa adwuma sambre ya na.
I will say a pin for an nursing mothers.
Yes. Omo ye nurses.
Okay.
Eko adwuma sambre ya na.
Okay. All right.
Okay. Morning, Honorable.
Yes, madam.
Oh,
yes, go ahead.
Pacho, my question is, you share a friend, Ghana Health Service for website, so omomu new death na account. If you have been through for below 40 years, Mr. Bako Krambo, who we know, only any lining Yaribia man, we see, per se, find DNA course, and I say virus now, you customer study the way I disobey, since was a new direction, Nama, course this new data without any underlying sickness and
okay. Okay. Thank you, colleagues. We'll wrap up the question and then provide answers. Let me quickly take the two that require government responses. Is there a government subsidy for evacuees? No, I do not have a brief to the effect that there's a government subsidy for evacuees. There are conversations about how the cost of upkeep to evacuees can be better managed. If it means in further conversations with the operators of the hotels that are hosting these evacuees, if that is a possibility, that engagement is still ongoing. But I'd have a brief that says that central government is providing a subsidy, the upkeep of evacuees. The second matter is that I'm not aware that government went to Parliament asking for money for the upkeep of evacuees. I am not aware of that. I think what we are aware of is that government went for money to provide for isolation centers. And as is being explained, for example, when persons have tested positive, etc., they are moved into isolation centers. That doesn't matter. Cost or their upkeep is not at their expense. For evacuees, apart from the category of evacuees who have been determined as destitute, who were sometimes living on the streets or who had been sent, let's say, by government to programs, etc., who have been assisted by government to come back and are being catered for government, for those who are coming voluntarily, they are prior informed of the cost of upkeep. And indeed, they have to show proof before they are given tickets that they are willing to undertake that cost before they buy their tickets from the airlines. So just to clarify, I am not aware, I don't have a brief to the effect that voluntary evacuees, people who are not destitute, people who are not, let's say, many government programs that are being brought back, voluntary evacuees, are aware that government has gone for money from Parliament, their upkeep. The approach is that they are prior informed of facilities that have accepted to accommodate them, the cost associated with it. And they choose their facilities and inform the authorities of saying before they are given a ticket to board an aircraft. And when they arrive, what they have chosen, they are ferried into those facilities. However, government has received concerns that the costs are a bit steep, and if there is room to engage with the providers of those facilities to do something about the cost, is something that remains under consideration. So I want to come to Dr. to help us with some of the questions.
Thank you very much. The first question is about what we do those who have discharged. The very reason why we isolate or we quarantine is because you have a virus that you can pass from yourself to somebody else. We are discharging you because you are not able to transmit any virus to anybody. And that's the very base. The other evidence is the fact that after 8 days, you cannot even culture the virus in those who are positive, which means that there's no live virus in the person. So once you do the 14 days, you are unable to transmit to anybody. So you go home as a free person, you can do whatever, but you have to continue protecting yourself and others, just like with the normal protocols. And so we are doing discharge because you are not able to transmit. So you don't have to have any special precautions on anybody. But we are still interested in the eventual recovery protocol, and that's why that will be done on an patient basis. Now, this is not being done because our isolation centers were full or anything. If you look at the places, I mentioned that the PDC, which is the main isolation center in the country, has a capacity for 600 cases. The highest we ever got in a particular day was 580, because we have moved some people from, we have some evacuees, we had to move people to the place. As of the 15th, 2 days ago, we had about 360 people there, so it was not there. But the social cost of somebody who is healthy and having to wait for results is important. And so we will need to look at, apart from the cost to the state, there's also a cost to the person. And so this evidence, there's no point in keeping anybody beyond that period, especially when they are asymptomatic. So that is not our hospitals, yes, but we have a challenge in a place like Kumasi. But one of the reasons is that there are also people in those few sites who are waiting to have their recovery by the protocol before they are discharged, even though they are not a threat to anybody. And so it will still go to help free not only the state resource, but also the social cost to the patient. CTFM. Yes. You see, in any hospital or clinical setting, there are days that you are going to have a few more cases than usual, and there are days we are, from what we are seeing, we are not seeing any persistent surge in any case. There could be a 2-3 days that you can have a few, and the next 3 days you have no case. And so if you look at the trends, which we share very soon, we are not seeing any surge apart from Ashanti region, where we felt that the number of beds there were fewer for the number of cases. But in this new policy, will help free up a lot of space.
The question is specific. Has there been increase in the number of facilities?
Yes, I'm going to go there. I'm here to get to that. As the city of, we started with 33 centers when we started the response. We had 33 treatment centers. We have 71 treatment centers. We had initially 450 beds allocated for them. Now we have 700 beds. So the treatment beds, no isolation, treatment. From 450 to 700. So remember I showed the 450 here. Now we have 700 beds across. Of the 71, 20 are technically closed because those regions do not have any cases. The Bolga had people there, they've all been discharged. So nobody, so we have 20 isolation treatment centers that are currently not being used. So that's where we are. So, and that's the situation. We are still going to have additional numbers. We are creating additional 12 ICUs in Rage. There are additional ones going to, especially in Accra, the Pantine area, Doha. We're still looking at expanding the number of cases. Should there be any surge? I think
for pregnant women or breastfeeders.
The city wanted to. I don't know what I should. Okay.
Before we wrap up, if you indulge me, so what specifically are you doing with the Ashanti region situation now? Yes, the economic director there announced that the situation is getting out. So what immediate steps are you taking?
Yes, even before the statement, we are also on the ground. So there have been moves to expand already, and work is going on in expanding spaces in Kumasi South. We have new beds in Central that we are going to use, but our plans to create a bigger center, a one-stop shop where we can like go east so that we can have the cases done. For pregnant women and medicine mothers, the protocol is very simple. These protocols of social distancing, hand hygiene, and the wearing of masks protects everybody, whether you are at home or at work. We do not have any reason to say pregnant women should stay at home or not, but this is a corporate policy that if you feel that you want to have some change, but we expect that all of them will go through the needed protocols to protect themselves and their children. And so we don't have the initial stage where we were decongested, but if you are doing social distancing in your workspace, and you may have to sort of let someone off, more free time, you may look at all those things like vulnerable people, the elderly, those pregnant women whose risk levels are higher. You may decide that you can let them go and have some more time off. So thank you very much.
Below 40 deaths.
Yes. Yeah, with the case. Well, I like Dr. Bedusa Akodie. to respond to the last question on the, and they give more explanation on the deaths.
I understand the question. The people that are within the lower age bracket, few of them that have been succumbed to the virus and died, and then not with comorbidity, and that is the virus changing itself to be more aggressive or more virulent. We have to take the situation in totality, the entire concept. All the cases that we have are the people that are dying, younger age group, those with or without comorbidity. And that's the context that you have to look at this. And not within the, you pick one case and use it to describe the situation and indicate that the virus is still more virulent or more aggressive. So looking at the total picture, the age, those people at the higher age group, and then those with comorbidity are those that are more at risk of severe disease, at risk of critical condition, and then also at risk of dying from the virus or the infection. So it's no evidence now to indicate that the virus is changing itself. If you look at the total picture, the entire picture that we do have. And you have individual differences. Some ordinarily, the older you are, the most likely or the risk of having a more severe and then critical condition that probably could lead to death. However, you have individual differences, and some people at a quite young age group could also die out of it. So the youth should not think that those to have severe illness, carry ill and dying is for the aged. Everybody can have it. Those without comorbidity should also not think that I have no hypertension, no diabetes, no other condition, so even if I have it, I have no risk of severe disease. So clearly, everybody, based on your immune status and then your physical makeup, depending on the viral load that you happen to have, you can still have severe condition, carry ill, and even die out of it. So I think that is the same answer to this. There is no evidence now that the virus has changed this, and that the people with comorbidity are most likely or most at risk to have severe illness and then suffer. But then anybody can also, as an individual, based on your makeup, can also suffer some of these extremes. Thank you very much.
Yeah, thank you very much. Just to top up, one of the challenges we are having is people are coming late. The disease has a natural cause, and those we see early recover. Even the number you see as critically ill, more than 90% do recover. But the challenge is that because of stigma, some people stay home. They don't want anybody to know their positivity. And they come in late. If you are young, if you are old, you stay home and you come breathless, then it becomes a bit more difficult for you to be managed. And so we are appealing, people should report early. Those who report early are those who also recover. If you look at the death and you go to us next week, we'll probably share with you a significant number come in and die within 24 hours. So they come in a bad situation, even though they know their status longer than that. So appealing that people should come in early so that they can be safe. Thank you very much.
Thank you, Doc. Colleagues, as we wrap up, I would like to reiterate the government's call to heads of regional and district coordinating councils that the executive instrument that makes the wearing of masks mandatory is out. And while we salute the efforts of those who have already started higher levels of compliance, we want to encourage those who have not, that the EI is out and they are expected as regional ministers, as MMDCs, to step up enforcement within their own jurisdiction. The mandatory nature of the nose and face mask shows that if majority of people are wearing it, those who have a viral presence in their system will not be able to spread it to other persons. We should be each our brother's keeper at this point in time. We thank you. God willing, on Tuesday morning, we'll re-engage for our next COVID-19 Ministers' Press Brief. Thank you.
The latest on the minister's press briefing as far as COVID-19 is concerned, our case count has gone up. We are now at 12,900 and over 60 cases, with the death rate still at 66. We also know that the active cases are in excess of 8,000, that is 8,395. So specifically in terms of the case count, we have 12,929, just a few digits away from hitting 13,000, and the active cases 8,395. The death toll is still at 66, and that's the latest from the press briefing. And the last point the information minister just made there about the executive instrument backing the mandatory wearing of the face mask. It is now available. It is law now. If you do not wear the face mask, there are sanctions. We'll bring you details of that EI in our subsequent bulletins. But also for you to know that the in terms of the testing and also the recovery, the policy has not changed from the Ghana Health Service. It's still 14 days after you've tested a double negative. And in terms of the discharge policy, that has slightly changed. Asymptomatic cases are being discharged after 10 days at the centers. The minister also did note that subsidies are available for evacuees, for those stranded abroad who want to return to Ghana but do not have the means or find it quite expensive. Government has made available some subsidies. However, we do not know how much and how these funds will be made available. Depending on where you are, we'll get those details for you also subsequently. But also, the director of the Ghana Health Service did note that there are some 20 treatment centers that are not being used, and we have some additional spaces also as well, 12 ICUs at Ridge and a few centers across the country. The Ashanti region situation for him is peculiar, and they're trying to deal with that. You have my colleague Ohimintia bring us up to speed on the expansion, the renovation going on at the Kumasi South Hospital, where the maternity block is being prepared to receive patients for treatment of COVID-19. And so that'll be it for the updates from the news conference. We're taking a short break. When we return, we'll bring you more stories on COVID-19 here on News Tech. Stay with us.